So what should we take away from this paper? Our feeling is that the key findings in terms of applications to clinical practice are, one, that we really should de-emphasize macrocalcifications in nodules that are mixed cystic and solid, or in purely solid nodules that don't have other underlying suspicious features. And so really focusing on the grayscale features and not worrying so much about an isolated and particular macrocalcification is what we would recommend. And then we also maybe need to think about lowering the FNA threshold in solid nodules that have heterogeneous echo texture. And so, whether that's biopsying them at a smaller size or doing more investigation into this pattern, those things can be considered, but certainly this may need to heighten someone's index of suspicion that a nodule could be malignant. There's certainly many goals in classifying nodules for the future. So larger studies investigating some of these less common ultrasound patterns could be really valuable. And then continuing to modify and align the thyroid nodule risk stratification systems, I think, is really important. And certainly in communication with patients, it can be a little bit difficult in times where different guidelines suggest different things in terms of what to biopsy and what to follow. And I think at times we even use these the guidelines, at least in my practice, I think to our own advantage to help back up what we want to do for a patient anyway. But I think having more consensus is something people are obviously working towards and would be of great benefit.